Health Novo presents Sushruta, our health awareness channel.
Now the question usually is asked, what should we do? Should we keep or should we remove it? If there is a pain, one has to remove it, and if it is not going to come out, one has to remove that. So let us see the different angulation at which the teeth comes. Now in this picture, you can see the gum covering, the wisdom is straight, wisdom tooth is straight, but a gum is covering. Why gum is covering? Because there is no space for the tooth to come out completely, and the back area of the tooth, the gum is covering, and that is when patient complain of the pain. The other is what we call as an angular. You can see this picture, the one which comes angular. Now teeth usually erupts or come out in the straight line. As this is in the straight line of the angular will go this way and it will never come out, it will remain inside. And if the patient complains of pain 1, 2, 3 attacks, then one has to remove it. This is vertical, that is a partially erupted, but because there is no space, it is not going to come out, then this has to remove. One is this is partially, this is vertical, this also is vertical, but this is vertical but totally inside, and this is horizontal, where is 100% is not going to come. My suggestion, if the tooth is horizontal or tooth is angular or tooth is vertical, it is inside the bone, not causing any problem, don't touch it, because treatment now and treatment then is the same. When you get a problem, it's not going to get deteriorated. But nowadays we have heard that people are removing the wisdom tooth at the age of 16, 17. Yes, one can do that if you do your x-rays properly. What x-ray? Look at this picture. This is the x-ray. One has to take what we call as a wisdom tooth x-ray, that is of OPG. And once we come to know that the wisdom tooth at the age of 16, which has not completely erupted or not completely formed, what we say exactly, completely formed, we can remove at this age, because we can predict that this tooth is never going to come straight. And if you remove at the earlier stage, is easy removal. If you remove at the later stage, the teeth become very firm in the bone, and removal is little difficult, but we can still remove it. Now you don't get confused when I said when there is no problem, don't remove it. But now I am telling you to remove it at the age of 16, because that we know is going to cause problem. It's easier to remove that time. If you don't remove, what will happen? You can look at this picture. You can see that a major angulated is giving pressure on the front tooth, and the front tooth get pressure pain. And when patient goes to a dentist, he complains of the pain in the second molar, but actually the causative factor is the pressure from the third molar. If you don't remove, what will again happen will be the decay, because food particle remain in this triangular area. We call that as a Bermuda triangle, a very dangerous triangle. And when the food particle stays and they can't be removed, they just stay there for a long time, is not only decaying the wisdom tooth, which you are maybe removing later on, but it is decay the neighboring tooth, which is very sad. The healthy tooth get damaged. So the advice is to remove the moment you know that this tooth is not going to come straight, it has come partially and the food particles are going in. That is the problem which we usually face. Sometimes so happens that the lower wisdom teeth are inside, or sometimes they are absent also, and the upper teeth has come straight. As there is no opposition, what happens? The upper tooth erupts more, comes down more than your neighboring tooth, which has got the opposition. And when this tooth comes down, there is a gap between the last, that is wisdom tooth, and the neighboring tooth, that is second molar. Food particles go in and there is a cavity. And the cavity is not only on the wisdom tooth, but cavity is on the nice, healthy second molar also. So in this condition, though there is no symptoms, though there is no pain, for the precautionary measures, you have to take it out. And another important aspect of this tooth, which has got no opposition and which has come crooked, especially upper, is causing ulcer in the cheek. And if somebody is getting ulcer on and off is not good, because any ulcer due to irritation can lead to cancer. So one has to take precautions about this also. Now upper teeth has not come and lower has come, same condition. You have to remove them because it's going to cause problem in the neighboring teeth. As a doctor, it's my duty to tell you what's going to happen. A good doctor will advise you properly after looking at the signs. Signs is what I see as a doctor. Symptom is what you tell me. So once I see the sign that is going to cause problem, I have to inform you. So it's up to you when to remove. But my advice is to just remove them once for all, so there is no problem.